Morning and welcome. My name is Chris Backus. I'm with the Virginia Mason Institute, and I was the workshop leader for this 3P workshop. Today, the 3P report out is for women's services at ENHTT. This will take 20 minutes, and followed by our sponsor and executive comments. We will not have a formal Q&A, but we do invite you to join in the conversation as the story continues after today. Imagine starting with a blank sheet. No constraints, no legacy, designing the ideal women's services experience from the ground up. That's what we did this week with this 3P. Using zero-based design, the team defined an aspirational true north and mapped a practical path from today to that future state. They've challenged their assumptions, they've moved beyond their constraints, and they developed a patient-focused, forward-looking roadmap. Here's their story.
Hi, my name is Alfred from the Gazan Promotion Office. The name of the event is Shaping the Future of Women's Services at ENHTT, Redesigning Pathways, Capacity, and Experience, with the objectives of designing a future patient-centered model of care across maternity and gynecology, guided by our true north, seamless, timely, women-centered care, every woman, every time. The project form serves as a guide during the week. It described the current situation and issues we're experiencing, such as service configuration and patient experience, and also sets the objectives of the week. Prior to the event, we have collected data from both maternity and gynecology services. Specifically, we have focused on their capacity, demand, layout, and flows of medicine. It showed that some linked services are far from one another. We have also noticed that some spaces are underutilized while some are overutilized. We have all taken this into consideration during our idea generation. We have used the zero-based design during the workshop. This means that we start from scratch when creating the vision for women's services. We have used the vote method, vision, objectives, tactics, and expectation to start our thinking, and paired it with the 3 radical shifts from the NHS 10-year plan. Moving care from hospital to community, transitioning from analog to digital, and shifting from sickness to prevention. We start the week by creating the long-term vision for women's services and generate the ideas from there. The team generated 46 ideas in 30 minutes, with the majority being on level 3 and level 5 on the level of change, defined as doing things better and doing things that the others are currently doing. We then created groups focusing on these aspects of the service: design of patient-centered future state model of care, pathways, redesign the pathways and service configuration to improve flow, reduce the delays, and create more joined-up care, and optimize the existing capacity and state.
Good morning. I'm Josie Reynolds, the Head of Governance for Women's Services. We were tasked with defining the vision for our future state, starting at zero base and assessing all idea generation through the 7 stages of change. We aligned this with the NHS 10-year plan, taking what can be done out of our hospital back out into the community, and moving from analog to digital, and moving from ill health to prevention. We remembered that we must work as one cohesive care group, all of gynecology, maternity and neonatal services. And we aspired to create a seamless service for all women across their entire life journey. And that was from adolescence, from fertility to conception, through to pregnancy and childbirth, and onto menopause care and healthy aging. We remembered the importance of co-production with women and with allied healthcare professionals, working with Hertfordshire County Council to utilise existing spaces and open up access to care for disadvantaged, vulnerable groups by creating community-based women's health hubs.
Good morning. I'm Pam Langford. I'm the head of midwifery. This is a purpose-built elective maternity and women's health centre, and it would provide us with a state-of-the-art environment for planned caesarean births and elective treatments. It's designed around family-centred care, focusing on improved safety, dignity, and operational excellence. This incorporates modern theatre facilities with advanced digital technology and the choice of amenity private rooms with enhanced infection prevention standards. There's also dedicated family amenities with a children's nursery to support our staff and families. And it offers a calm hotel quality experience while maintaining seamless access to specialist obstetric, neonatal, and anesthetic support. By separating planned activity into the community from emergency pathways in the acute hospital, the elective facility would improve efficiency, reduce delays, and create a sense of excellence for elective maternity care. This supports the Trust's ambition to deliver world-class services for women and families, whilst establishing our Trust as a regional leader in elective maternity care.
Morning, my name is Imani Kondo. I'm a consultant obstetrician and gynecologist. So our vision is to establish a new woman-centered service that is fully operational within 5 years. This will be guided by a clear roadmap structured across 3 strategic implementation timelines. A key early priority is delivering an outstanding patient experience introduced by introducing community-based and home-based post-operative urinary catheter care. This is in light of recognizing that failed removal of urinary catheter after operation is a major driver of prolonged hospital stays. So we aim to create a service where patients can confidently and safely complete removal of their catheters at home, either independently or with support from a trained practitioner. This will improve comfort, autonomy, and overall satisfaction with the care we provide. By shifting appropriate care into the community, we will free up valuable bed space and staff capacity for patients who need in-hospital care the most. This will strengthen both efficiency and quality across the service.
Good morning, everyone. I'm Agim. I'm one of the registrar doctors in obstetrics and gynecology. We envision that by strengthening our public health and primary care, we would be able to decongest our hospitals and create more opportunities to provide specialized care for our women and make our trust the center of excellence and research.
Good morning, everyone. My name is Noreen. I'm a healthcare assistant based in Guiney. Our vision for the future is to create women's health hubs. These hubs will be based in the community, allowing seamless, personalised and holistic care closer to their homes. We cover a wide geographical area with many different social economic groups. To ensure equality for all, we will provide a bus or ambulance service for ease of access. Utilising technology, women will have the tools to empower themselves to access care tailored to their individual needs. This will be in the way of an app. Ultimately, our vision is to eliminate health inequalities and create a sustainable NHS for future generations to come.
I'm Anna McDougall, consultant obstetrician and gynecologist. So we will bring the hub concept into effect immediately to relieve pressure on secondary care women's health bottlenecks. In the next 0 to 6 months, we will harness and develop partnerships with primary care, and we will establish community gynae clinics 1 evening a month, which will enable us to upskill GPs and advanced nurse practitioners in simple gynecology procedures. We will also develop a one-stop menopause clinic and streamline our postmenopausal bleeding pathway. We'll move any services which are suitable to do so out of the secondary care setting into community setting. In the next 6 to 12 months, we will develop some self-check-in portals for patients, which will allow a streamlined booking-in system in multiple languages and focus on patient education and information, utilising industry partnerships to produce high-quality patient information videos and resources. We'll begin work on a fully integrated women's health app and also update the NHS app to be integrated with updates as to where you are on your pathway, for example, if waiting for a surgical procedure. We will streamline the fertility referral process by developing further these partnerships in general practice to ensure that people are not inappropriately referred and enabled to optimise prior to referral where needed. And we will pledge to reschedule all cancelled appointments within 12 weeks with a more robust appointment system to avoid any repeat cancellations that patients have been suffering. The first model for hub will be developed in pelvic floor physiotherapy and pessary clinic. In the future, in the 12+ months vision, we will have these 2 fully integrated hubs up and working, and they'll be working together, integrated with Women's Health app and with seamless integration with primary care.
Good morning. My name is Krishna Madala, and I'm one of the gynae nurse practitioners. So I will be guiding you through a seamless pathway for an obstetric patient who comes in the Women's Hub. So our sample patient's name is Isabella. She's 26 years old. It is her first pregnancy. She's 16 weeks pregnant. She woke up and found that she has PV spotting, and she is very worried. So Isabella is aware of the Women's Hub. She has self-referred, did a self-check-in. She was welcomed by the triage nurse. She had observation. She had a bedside scan, speculum examination. And if results were all normal, Isabella will be discharged with safety netting and with health education with regards to other possible causes of PV bleeding in pregnancy. If Isabella has got maternal complications or the baby has no fetal heartbeat, then Isabella could be transferred via the Women's Hub bus on standby to transfer patients if patient does not have transport and brought to maternity triage for further care. Thank you.
Good morning, I'm Emma Mason. I'm a graduate management trainee working as assistant service manager within Women's and Children. We have mapped out what a typical pathway may look like within the hub for a gynae patient accessing our service. We've based this around a fictional patient, Kate, who is a 56-year-old woman who is on continuous combined HRT and has had new unscheduled bleeding. She would be referred into the hub by her GP and she would access the one-stop clinic. She would have a scan to assess the endometrial thickness, and depending on the outcomes of the scan, this would determine which of these sort of 3 pathways she would access. The golden thread running through these pathways is that care will be timely, centered around the patient's needs, and if required, she will be booked in for outpatient's hysteroscopy there and then to assure that continuity of care.
Good morning, I'm Helen. I'm the midwifery-led unit ward manager. Our subgroup was tasked with optimising our existing estate's capacity. This change is needed due to the 3 primary changes for change that we've identified. The first one being gynaecology services are currently fragmented with no designated inpatient ward for gynaecology. The second is our current facilities are not consistently aligned with demand. This reflects the change in clinical need, including increased pregnancy complexity, rising caesarean section rates, and the reduction in midwifery-led births. The third driver is service user expectations have evolved, requiring modern, accessible, and responsive service units.
Good morning, I'm Bex. I'm a matron in maternity. So with the why and the service user experience in mind, we have reviewed our current estates and developed a proposal of a 5-stage plan. This will bring together the services and support efficiency, and importantly include facilities for the ever-changing workforce. So as Helen stated, the key priorities for us are integration of gynaecology services into our estate. So we are proposing a fully functioning suite, including outpatient and inpatient facilities, and also theatres and administration spaces. Secondly, our day assessment unit capacity. We are proposing the creation of a maternal and fetal assessment unit, which combines our maternity triage and DAU. It relocates our antenatal clinic and also our scanning to support the efficient flow through the service. We've also included in our considerations bereavement suite, maternity theatre complex, and a staff wellbeing hub. We welcome some of you to our open house on Wednesday, and we have taken feedback on our ideas. This has led us to develop Plan B.
Hi, my name is Fran. I'm the ward manager of 5A. A gynecological ward isn't just another part of the hospital. It's a vital service that protects women's health at some of the most urgent and vulnerable moments of their lives. A dedicated ward means women are assessed rapidly, treated safely, and cared for by professionals trained specifically in reproductive health. It ensures access to the right equipment, the right surgeons, and the right support, not just medically, but emotionally too. Without a gynecology ward, these patients would be left to general wards that simply aren't equipped for the complexity and sensitivity of their needs. In short, a gynecological ward saves lives, protects dignity, and delivers the specialist care women deserve.
Hello, I'm Lynn. I'm the manager of the Day Assessment Unit in Maternity. Our proposed changes are going to mean women accessing maternity services will experience a more streamlined service. Women will have shorter waiting times for ultrasound and getting reviewed by the correct grade of doctor in a more timely manner, as currently nearly 50% of our triage admissions are waiting too long, and this presents a risk. Women accessing both the MLU and the elective section pathways will experience less cancellations and diversions of service and will experience greater patient safety. Also, women who have suffered bereavement will be cared for in a much better environment, improving their experience at a time that matters most.
Hi, my name is James and I'm from the Capital Projects team. I'll present the timeline for our ideas. How do we put all of these incredible ideas into action? Our first objective is finding out what we can potentially do now and how we can improve the service in the short term. In the first 3 months, we will look at the possibility of creating an ultrasound scan room on the MLU. We will also look to push forward our bereavement suite planning, firming up plans and bringing in our charitable partners engagement. In our first 6 months, we will look to collect and consolidate data, which we'll use to prove or disprove our hypothesis and define our need. This will include outpatient review waiting lists, ultrasound services, utilisation and demand, pathway review for DAU and triage, data to look at the need for the third maternity theatre. We will look to complete a review of ANC ways of working in preparation of a move. Our 9-month objective is to develop a schedule of accommodation and to create a business case for full architectural design in the second financial year. This is the beginning of an exciting journey, which we're all really looking forward to seeing where it takes us.
So we had many lessons learned this week, and this is just a summary of what the team shared this morning. So that no idea is a bad idea, and that all ideas lead to solutions when we properly define the problem, and that everyone's ideas matter. The collaboration across teams is powerful, and taking the time to creating space for this multidisciplinary group to come together to generate their ideas and act on them was truly transformational. Problems are no one's fault, but everyone's opportunity. Public health, primary care, teaching hospital trust, all are essential elements for public well-being. Different perspectives are essential for change. So it's not just the people with the willingness, it's the skeptics, it's the people who ask really good questions that really help bring ideas forward. There are solutions to all of our challenges. They currently exist in nature and they exist in all of us already. We just have to find a way to bring them forward and hear all the voices. And that we are ready for the future as a trust, as an organization, as a community. And we actually got a wonderful little poem from someone's gran. Think big and your ideals will grow. Think small and you'll fall behind. Think that you can and you will. It's all in the state of mind. We'd love to thank, first of all, the team that stayed back and took care of patients and kept doing the work so that we could be here this week. It was very important that you did that work so we could do this work. So we thank you. This amazing away team just brought it and did great work. For all the people who came to the open house, provided their ideas and feedback before, during, and after the workshop, we thank you. For KPO, for the data collection, and all those who worked with KPO to bring this data forward, we appreciate that. For the advisory members who came when we called, for the executive and transformation guiding team that supported this effort happening, thank you for this really incredible opportunity. And for all of you out there who are about to take part in this vision, it will happen with all of you working together with us with that mindset of what if we gave it a try? Why not get started? So thank you in advance. And now words from our sponsors.
Hi everyone, I'm Amanda. I'm Lead Divisional Director for Women's and Children's and one of the sponsors of this event.
I'm Mona. I'm a consultant obstetrician and head of clinical services for Obs and Gynae and one of the co-sponsors.
So for starters, wow, absolutely wow. I can't believe what has been achieved this week. On Monday, Mona and I set this challenge with a simple question. How can we design a seamless, timely and compassionate service that truly works for women every time?
We asked you to think differently, to challenge assumptions, and to keep women and families at the heart of your thinking. Looking at what you've achieved today in this week, it is clear that you've done exactly that. You've remained focused on the experience of women and families, whilst being ambitious about what the future could look like. At the same time, you haven't lost sight of the change that could make a real difference to women and staff from tomorrow. That balance between vision and practicality is one of this team's greatest achievements.
What's impressed us the most has been the collaboration, the commitment and energy in this room. You have brought together different perspectives, challenged each other constructively and worked together with a shared purpose to create something better for our service users. I want to give a special shout out to our two process owners, Amani and Pam. Your leadership, encouragement and commitment to this project have helped guide this work throughout the week. You've kept the team focused, motivated and moving forward. So a special thank you to you both. And finally, thank you to everybody who's contributed. I hope you're incredibly proud of what you've achieved. Mona and I are certainly incredibly proud of you. This week has demonstrated what is possible when we come together around a shared vision and keep women and families at the centre of everything we do. The real work starts now, but I genuinely believe that what has been created this week has the potential to transform services and improve the experience of women and families for years to come. So thank you, congratulations, and very well done.